Thanks for standing by and welcome to the PainChek investor webinar and Q&A following the company's quarterly update. Please note that the presentation being used today has been lodged with the ASX this morning. All participants are in a listen-only mode. There'll be a presentation lasting for approximately 20 minutes, followed by Q&A. If you have a question you'd like to submit, please feel free to type it in using the Q&A function within Zoom. And please note the session is being recorded. On behalf of PainChek today, we have the CEO and Managing Director, Philip Jaffis. I'll hand it over to you, Philip.
Thank you, Matt, and good morning and welcome everyone. And thank you for taking the time to join me this morning. I'm pleased to present the quarterly results and also some updates generally in October for PainChek that just reaffirms the great value and the rapid take-up of the pain technology across now 3 continents. This is making PainChek a new gold standard in assessing pain for vulnerable people within aged care, home care, and the hospital sectors on a global basis. So for those new to the story, provide some background. And firstly, pain assessment is difficult. And our mission is to give a voice to people who cannot reliably verbalize their pain. On one extreme, we've got adults, such as those living with dementia or cognitive impairment, who have lost their ability to communicate effectively. On the other hand, with other extension, pre-verbal children who've not yet built those communication skills. In these situations, pain may be missed, it may be under-diagnosed or over-diagnosed, and therefore under or over-treated. And in some cases, pain is misdiagnosed and therefore mistreated in these populations. Our goal is to ensure pain is properly managed for these people, and we've developed PainChek apps in the form of both an adult version and an infant version using AI and smart automation for both these vulnerable groups. People often ask me in these presentations, what's the competition? And the competition has historically been the manual tools such as the Abbey Pain Scale, which you can see on the left-hand side, the legacy pain assessment tool. And these were developed for this need to assess pain and found broad use in many countries across the UK, Australia, and USA. However, the Abbey Pain Scale was difficult to put into practice. It's subjective, it's largely paper-based, it's not being used at the point of care, which is where pain assessment should be conducted, and it doesn't integrate, obviously, into other digital clinical systems, which often means the data captured is largely inconsistent and may lose integrity. Now, Dr. Jennifer Abbey, who is the developer of the Abbey Pain Scale more than 20 odd years ago, is actually on our advisory board. She is our, as you can see from this quote here, she is one of our best supporters, and she sees PainChek as a tool to improve pain management practices for these vulnerable groups. And as you'll see today, we're getting great feedback from clients all around the world and that we're achieving this goal today. Therefore, making PainChek, as I said, the gold standard in pain assessments and therefore driving better pain management. So let's look at the technology. So this is the adult version of the product. It's a regulatory cleared digital medical device that comes in the form of an app to assess pain for people who cannot reliably verbalize their pain. It works on any compatible iOS or Android smart device, be a phone, an iPad, or any other technology base. What it does, it utilizes AI in the form of in the camera in the smart device, and using automated facial recognition analysis to detect the 9 microfacial features of pain, which we call action units, indicative of the presence of pain, and it stores them for the user and the carer. The technology then guides the carer to complete a full observational pain assessment and produce an overall pain severity score from which pain can be better managed. In simple terms, we say this is a combination of artificial intelligence with human intelligence to drive better care. The other point about PainChek, it's rapid, it's simple, it's easy to use for any trained carer, and that includes these days we're moving towards family members of people living with dementia and other conditions. If you look at the market sizing, we've got more than 57 million people now living with dementia, growing to 150 million by 2050. And people with dementia triangulate their time between aged care, home care, and hospitals, where in the hospital they could occupy more than 30% of beds at any one time. So we've established a market entry on all these 3 sectors, aged care, home care, and hospital, for the adult patient adult PainChek app. The infant market opportunity dwarfs the adults, with 400 million children, of which 150 million newborn each year. We see the infant app having a significant home-based opportunity, and we're about to start the first commercialization of that product this quarter, so that mums and dads can use the PainChek tool to assess pain in a similar manner as they would use a thermometer to assess their children's temperature, combining fever assessment and pain assessment in the home environment. Sizing of these markets is pretty well established now. We know that there's 6 million aged care beds, and at our pricing of $50 per annum per bed equates to around a 300 million value in aged care. We know that home care market is expanding, and I'll talk about that more in the Australian context. It's going to be significantly bigger, and it's going to be driven in many cases by those who were providing aged care services. Infant market, I mentioned already, 1% of that infant market could equate to the same value, about $300 million, as the whole of the aged care market. And we've got an agreement now with InterSystems, and we're starting, in fact, I'm off to Europe in a couple of days' time. We're starting in Scotland with InterSystems and the Royal Edinburgh Infirmary as the first product to be used, PainChek adult use, in the hospital sector in Scotland. So let's talk a bit about progress up to now. So as of September 30th, we now had 77,000 licenses, or beds or licenses, across more than 1,200 aged care facilities now across 3 continents. So this is making PainChek a truly global healthcare business. You look to the bottom right, Australia and New Zealand, we've got now 56,000 contracted beds, reflecting a 30% penetration of the 200,000 bed Australian care market, making it the most popular clinical tool, digital clinical tool in aged care. The UK team actually, if you look at what we've just done in October as well, after a quiet summer, we've now 21,500 contracted beds, and across 400 aged care facilities, and a qualified pipeline that has more than 40,000 beds. And I'll talk about that when I get to the UK slide. I mentioned the Scottish Hospital pilot, which I'll be looking at commencing this month, in the November month in Edinburgh. And finally, across to the left-hand side, you'll see that we've got our first sales, that we've got the first 2 clients in Canada on 3-year agreements. And we're also working on getting the FDA clearance in place for submission later this year, early next year, and entering clearance in 2024. And I'll talk about the US later as well. Now, we've got 77,000 beds, but our partnerships with care management systems and medication management systems gives us access to 1.5 million aged care beds. This is a profile of the partners we have across the UK, Australia, New Zealand, and North America. And these partners do 2 things for us. Firstly, they ensure that our technology integrates into their patient records and medication management systems, saving time and effort for carers and supporting the delivery of better care provision. The second thing they do is they give us a pathway to these 1.5 million clients that they contract to together, which is more than 20 times our current bed numbers. Some of our partners here are working with us right now to look at how they can become a reseller of our products and penetrate their client market directly. These partnerships are critical for us. They're really important. They represent how much value we give to our partners, and they're continuing to grow globally. So look, a quick summary on the growth over the last year. As we said in our updates, the 4th consecutive quarter of double-digit license growth globally. The 77,000 licenses, about 3.7 million ARR when they're fully implemented, and that's 10% growth from the previous quarter. Within that, we also have a strong pipeline of sales across the existing markets, and we've trained a significant number of users. This is our ARR. ARR is 3.7. We're still achieving between 70 to 85% gross margins and an 85% retention rate on annual renewals. This is a very strong renewal rate. We're keeping all the large clients. Any losses are still typically with smaller facilities that don't have the staffing or struggle with technical integration issues that have still got to be sorted. We will get back to them in the future when they're ready, and we expect that retention rate to increase to 90% plus going forwards. As I said before, many times, we document every single PainChek assessment conducted, and we now have more than 3.4 million global pain assessments. And this is a 500,000 assessment growth on the previous quarter. So it is exponential growth. And as I said before, we've now trained more than 13,000 carers. And those carers we train, it's not just about training on PainChek. We train them on pain management and what it means. And we have strong educational programs, both online and also with partners all around UK, Australia, and New Zealand. So we're giving an educational service on top of an actual product service. So let's talk a little bit more about Australia. As I said before, now we've got 57,000 beds contracted and across 800 aged care homes. And these include large, mid-sized and small facilities. It's a 30% penetration for the local market and still growing significantly. New clients in the quarter, we're delighted to confirm Uniting Care Queensland, who became our largest client, 3,750 bed agreement, which is now our largest agreement we have in the company, and that's for 3 years. That's a significant agreement for the business. We also welcome Eldercare, 1,300 beds across 12 homes, and Castalia Performance Pty Limited, just over 1,000 beds across 10 homes. As you can see here now, our top 10 clients now cover 25,000 beds between them. So what's driving this, and what's this meaning, especially for the home care and retirement living sector? Well, in aged care, the key driver is that the market is consolidating, with large providers acquiring smaller homes, and these providers are all going fully digital to automate and better manage their care. PainChek is the only digital regulatory cleared medical device that assesses pain and with clinical evidence outcomes. And in this case, we help our clients achieve their clinical and quality goals, which are mandated as part of the regulatory standards. So we will continue to expand and grow in this sector. What's also happened, though, is a really big shift is happening right now into retirement living and home care. New government legislation around with all the consumer directive care allows care funding to be accessed in the location of a consumer's choice, driving therefore growth in home care. We've now seen that government-funded home care packages now exceeding aged care beds. There's more than 300,000 or close to 300,000 home care packages. And why is this happening? A few reasons. Firstly, the demographics of this country and other Western world countries is showing that the percentage of 80-plus population, 80-plus age population, is going to double between 1.2% in Australia to more than 2% of the population in the next 10 to 15 years. At the same time, the incidence of dementia is also increasing significantly. Therefore, home care for the elderly population that takes them not just to stay at home, but right through to end-of-life care is not only desirable for the consumer, I mean, we all want that, but also for the government as it reduces cost. To make this work, better pain assessment is critical to enable the sea change. And I'm pleased to say that we're now working with a number of our large clients, including 3 in that lower box there, to start looking at how we bring PainChek into home care and retirement living through their domination of these areas, and in doing so expand our market opportunity. So significant growth in retirement living and home care expansion, not just in Australia, but this is a global phenomenon that's going to happen in the next few years. We look at the UK, we've now, if you include what's happened in the last few weeks in October, we've now got 21,500 beds, growth, it was a growth over the previous quarter, and significant partners actually coming into play now. We've now got Bupa UK, which is actually an agreement we've been working on for about a year. I know I met with them over a year ago when I was in the UK. They've started now with an initial 500-bed pilot license agreement across 8 care homes, but with the potential for up to 8,000 beds across their whole estate. If that happens, that will be by significantly our largest clients. In addition to that, Dove Haven recently signed another 1,000 beds. So growth in the UK is starting to accelerate, and one of the biggest opportunities we have, which we mentioned before, I want to talk about is in Scotland, where the Scottish regulator have taken us into a stage 2 of a pilot study with them. These are paid pilots. The initial phase was for a small number of beds, but this can now lead to up to 38,000 beds across 1,000 homes. So let me talk a little bit more about that on our next slide. This is some of the communications that came out just last month from the Scottish Care Inspectorate, and who are the Scottish National Care Regulator. And they've reported very positive progress using PainChek in the first phase of their study, a paid study, and have now endorsed PainChek into their National Care Improvement Strategy document. It's very rare a company gets their name into a formal document by government. And we've also had some significant publicity in the Scottish press. So as you can see here, we've shown that by bringing PainChek in helps reduction of falls, a reduction of stress and distress-related incidents of residents, and more appropriate medication. This is now leading to a second stage of work across 15 aged care homes, and they're looking to see how they can adopt and implement PainChek into long-term sustainability across Scotland social care. That could lead to 38,000 beds across the Scottish market. I think this quote from the Scottish Inspectorate says it all there in terms of the benefits that they see already. And of course, we'll keep you very much updated as to how that progress happens. And I will be in Scotland, as I said before, in November. Another positive one is this Canada. We've got our first 2 clients in Canada. St Michael's in Edmonton was the first, and rapidly followed by Sherwood Care, also in Edmonton, both on 3-year agreements. Again, significant local publicity came out in Canada about this new AI technology that helps improve care for people living in aged care facilities. And we've got a number of other Canadian clients now trialing, looking to move to commercial agreements. Again, comments from, you can read here about how PainChek positively impacts quality of care, pain management, and these comments are consistent with the comments we get from the UK and Australia. The other thing about being in Canada, it gives us a really good base to actually start our planning for the US market. Coming on to the US market, we have now, I want to talk about 2 key areas for the US. First of all, our FDA de novo study work, that's all started. The 4 clinical sites in Iowa have been onboarded, all staff have been trained, and recruitment of subjects have been commenced. We have a 5th clinical site now in New York, which will be doing the multicultural assessments across their group of aged care clients, and they're finalising the ethical approval for the internal review board prior to commencing the study. The study now will be started ideally end of the early next year, and is scheduled for completion in Q1 2024. We still project clearance in the US for Q2 CY 2024. And the second point about this, in preparation for the US market entry, we've still got those 3 partnerships with Point Click Care, the integration partner for aged care, with Ethos Labs for sales and marketing distribution to aged care, and InterSystems, which is a global partnership for the hospital sector. So everything's going really positively, and we still project to be in the United States by 2nd quarter calendar 2024. Finally, I want to talk about the infants. So it's really a three-step strategy we talk about getting to the market. So as you know, we recently completed some market research with parents on the utility of the product, and we've now finalized the new version of what we call the face-only version to start an initial direct-to-market, direct-to-consumer commercialization targeting first-time parents in Australia. The new version of the infant app basically, it now includes a more robust facial detection process that's been developed to compensate for an infant's rapid head movements when trying to do an assessment. Adults don't move their heads that much, but infants, especially in pain, move their heads significantly. So we've actually improved the product specifically for infants to pick up pain expressions even with rapid head movements, which is another breakthrough technology. So we're taking a stepwise approach to commercial launch, initially with a group of first-time parents, building a community of users, home-based users, starting in this quarter, Q4 2023, and expanding more broadly in the first quarter of 2024. The learnings from these will be used to provide the basis for finalising the broader commercial launch in the UK and Australia in Q2 calendar year 2024. Now, the other thing that's really exciting about the infant product is that we've completed the R&D for a vocalization AI feature that will analyse an infant's cry sound to assess whether it's crying due to pain or no pain. And a prototype is arriving in our office in early December, initially on a desktop, but also then eventually will be an app, like a Shazam type app, which will basically listen to the sound of a cry and detect whether that's a cry of pain or no pain. Adding that technology to the facial technology will increase performance and also give much more flexibility in terms of how we use the product. So here's a scenario that we like. It's one scenario of many. A parent or a caregiver hears a patient, their infants cry at night. Obviously, most parents these days have baby monitors that pick up those cry sounds or those sounds. Incorporating PainChek either into the baby monitor or leaving it just on the app as a Shazam type of tool can help the parent determine whether that's a cry of pain or no pain. The parent or caregiver obviously intervenes and treats accordingly. And then if it's a cry of pain and it's clear pain, then the PainChek infant facial technology measures the quantitative element of pain and the monitoring element to see if the intervention, the treatment, actually addresses the pain. The combination of the two, the vocalization and the infant, will be in one product anyway, so this could be used by caregivers, family members, anyone to conduct that pain assessment in any scenario. So very exciting, and our goal here, as we said at the top here, is to make infant pain visible and audible. So finally, we'll continue to update the market on progress the next few months. We're going to continue to expand commercial beds in aged care into retirement living and home care, leveraging the positive outcomes to date and the large qualified pipeline. We're doing this with significant partnerships, more than 20 integration partnerships to date around the world, which will positively drive the sales and the ARR in the short term. We continue the FDA clearance work and are well positioned to enter the North American market in total with our US-based partners. And by the way, we are looking to recruit somebody in the US to be our business development person who will work with those partners and build those relationships. We'll expand our hospital presence with InterSystems, commencing in Scotland, as we talked before. And well, of course, now we're embarking on this direct-to-consumer, direct-to-carer program with the infant app to access the large infant market opportunity. In summary, we're well positioned on all fronts to continue our mission of making PainChek the global standard, gold standard to better manage pain in all environments. This is a summary, a corporate summary as to where we were recently. I want to say thank you to our shareholders for ongoing support and support in the recent capital raise. The cash position does not include the $720,000 coming in November as a second part of the tranche, and also the upcoming $1 million R&D rebate. And as you see, the company is generating real cash to fund the business and demonstrating strong top-line year-on-year growth. Board and management retained stable, around 10% of the company, and have all come in on this most recent capital raise, and the company has no debt. So I'll hold it there for the moment and take any questions.
Thank you, Philip. As you've mentioned, we'll now jump into the Q&A component of the session. Once again, if anyone in the audience has a live question they'd like to submit, please feel free to use the function within Zoom to do that. Philip, the first question I have is, what have been the results from the second study of marketing the infant app?
Yes, look, as I said before, the study work really showed that we needed to actually make the facial detection system more robust to pick up facial movements of an infant, rapid facial movements, and we've done that and conducted that and completed that, so that's good to go. And the other things that we picked up were simple things like privacy issues and not wanting things like necessary dates of birth, particularly, or actual names in there. So a lot of it was around privacy. but the biggest technology thing was about making it more robust for easier use. We also got positive feedback on the vocalization. People loved the idea of having that vocalization concept where they could be alerted during the night to pick up sounds. That's what actually helped fast track that project. We had the technology, we had the data, so we put the data science onto it and actually have come up with a really nice technology. The vocalization is over 90% sensitivity and specificity, which is phenomenal for a technology of that type.
Thank you. Next question I have is, when will it be, again, with regards to the infant tab, when will it be released to market, and what is expected uptake and revenue?
Yes, well, we're commencing now with this, commencing this quarter, we're building that infant community of users. That's going to be a voluntary entry, looking to 50, then move on to 100 rapidly. And when we've gone through that phase, second phase will be to expand that group, and we'll get to a certain point by the end of Q1 next year, where we've got the full marketing mix finalized, the price, the product, the promotion, the distribution, everything completed. And then we'll be going to market and looking for commercial sales late Q1, early Q2 calendar 2024.
Thank you. And the question that's come through is, are there any updates on clients in Singapore?
No, actually nothing. We haven't done any more work in Singapore so far. We just had our hands flat. Remember, we're a 25-person company. We're selling into Australia, New Zealand, Canada, UK, and we're moving into the US. But certainly, yes, we do have regulatory clearance to Singapore and Malaysia. And we do have a number of opportunities in Asia, also work with InterSystems in the hospital sector. So we'll get back to Singapore in the very near future. Thank
you. There's a couple of questions have come through just with regards to the regulatory hurdles for FDA. So can you just speak to that, both in terms of PainChek Infant as well as the aged care product?
Oh, right. Yes, interesting. Well, the infant, actually, we can bring into the US under the CDS rules. That's a bit different. So that's a different play with the infant product. As a clinical decision support tool that could be used in the home environment. So that's a different avenue approaching. But with the adult version, we've as I said, we're going through the FDA de novo clearance. We've got the studies all in place, so mostly in Iowa, and plus another group in New York. The Iowa one's chugging ahead really nicely. Should all be done before the end of the year. The New York one just doing this internal review, because obviously they're looking to trial it on multi ethnic groups in their facility, and they want to get some sort of clearance within their board. That should be done within a week or two, and then that project starts. So I see that we'll complete the studies and submit the work in early 2024, but still puts us on target to be in the US market with the adult products by the second quarter of 2024, and after FDA feedback.
Thank you. Once again, there's a couple of questions with regards to the rate of implementation, and specifically what's being done to increase this, and is that with regards to training as well?
Yes, look, we've signed up a lot of aged care facilities in the last 6 months. The UK had a very strong quarter, actually. I think they went about close to 3,000 beds, which was very positive. Australia's we've been more and more on top of it. UK have still got some catching up to do, but they've increased their partners for training. We've actually brought on a couple of extra people in the UK that's actually ourselves for that. And we're catching up gradually, but there'll always be a lag between sign up and implementation. But the lag right now is a bit too fast. We want to rapidly increase that. So we've implemented 10,000 plus beds in the UK, and we've got a strong implementation program for the October, November, December period.
Thank you. What's the challenge facing aged care providers who have not adopted PainChek into their dementia patients within Australia?
It's a really good question. I think, you know, we had a session yesterday on exactly this topic. And as I mentioned about the, you know, the new standards and new requirements, the clinical governance and the clinical quality standards are increasing all the time in aged care. The Labour government are driving it even to another level. I'm just taking Australia as one example. As therefore, what we're seeing is the take-up of PainChek is actually, you know, once this integrates with their into CMS system, we've integrated with everyone now, then this is it's almost like it's a straightforward process. They need the tool, they need to show they're managing pain effectively, they need to have it all documented, and we provide that as a regulated device. So if you're using PainChek, very simply, your accreditation process from pain assessment standpoint is pretty straightforward. And that's what everyone's seeing, and that's why we're at 30% market share already in aged care, and we've got a very, very strong pipeline in the Australian market, which, as I said earlier, is extending into retirement living and into home care, because that's where the care will be provided for people long term. In long term, aged care won't grow, it will stay static, may even decline somewhat. But with the population demographic changes, with all these services, we moved into the home care environments. And if you haven't got a digital technology that what we're doing with, it's interesting, what we do with PainChek is that we can have a carer, we call them formal carers, like a nurse or a trained carer, conducting pain assessments. But as we're going to do in this in our program, we're also going to enroll the family members to be what we call the informal carers, who can carry on doing the assessments between visits, but share those results in real time back to the formal carer. That's going to be the model for the future. We've actually developed it already. We called it our shared care model. And that's, Australia's moving that way. The UK is moving that way. That's how it's going to be. That's how we're going to manage care in the long term. So perhaps next time I should do a bit of a longer talk about this whole shift in how the market's working. And that's why we're getting great take-up.
Thank you. Another question with regards to infants. Can you share if you've had any conversations with baby monitor companies already?
Haven't directly had contacts already, but, you know, we do have the long-term contact with Philips. I haven't reached out to them yet, only because they've gone through some significant company issues with their ventilators in the US. I don't know if you've been following it, but they've had a lot of issues in the US, and they've had withdrawals and recalls, and it's caused the company enormous issues. In those situations, you know, it's hard to sort of get their attention. But once I've got the prototype, which I'll have in December, of the vocalization as well, then I'll be meeting up with them, absolutely, because then they'll see how it works, and they'll see how simple it is to bring it into baby monitors. And they won't be the only one we'll talk to, but they will be one of the first points of call, because we still have a very good relationship with them.
Another question that's come through is, what has happened with previously announced talks with Boots and Philips?
I think I've covered Philips just then. Boots, it's interesting. I think I've covered this before. We were very close to doing an agreement with Boots, because they cover about 40 to 50% of the aged care sectors. For example, they cover Bupa, and they cover HC1, two of the biggest suppliers to the aged care groups in the UK. As it happened, it didn't quite work out because they had change in management. Various things happened in the company. As it happens, we've already now established agreements with those people directly. So what we've done is we've saved ourselves 30 to 40% margin by doing it directly rather than doing it through Boots. If Boots, you know, we're in still good contact, and if it makes sense, you know, we can relook at the agreement. But, you know, why not keep the margin for yourself when you can, rather than giving it away when you don't have to?
Thank you. The next question is, how much revenue would the potential rollout of 38,000 aged care beds in Scotland bring to the company?
Oh, well, times it by 50 per annum, then you can work that out yourself. I think the more important way to look upon this, though, is if you look at, we're starting to attract the big clients. HC1 have got more than 17,000 beds, and we've already got a pilot with them in the UK. Bupa now, we've got the pilots work with them, they're 8,000 beds. Scottish Care Spectra, look, what we've done there has been phenomenal. They love the products, you know, they control 38,000 aged care beds. And we're also talking to a number of, in the UK, a number of governments and councils for independent funding to go into aged care, because sometimes aged care facilities do not have the funding themselves. So you can see we're touching 3 or 4 major levers that could actually transform our whole business in the UK. We're at 20,000 beds today, but add all those others, we could be at 70, 80,000 beds within 12 months plus.
Thank you. Next question is, how confident is the team in regards to any issues with the use of the app for FDA ethnicity and why?
Yeah, look, we're very confident because we use the app every day on all ethnic groups. So we've got 3.5 million pain assessments. And I've been in rooms we've not had any issue back on because we've had no issue back on the ethnicity. And if you think about it, we're just looking for microfacial feature movements, we're not looking at colours or ethnicity of facial skin. And that's what the AI does really well. So we know that will be fine. But of course, we do have to go through the whole assessment process with the FDA and document it and validate it. But you know what? It'll be very helpful for our work in other countries. And by the way, I haven't mentioned this, but Japan have come back to us just literally last 48 hours. The PMDA, they've come back. They've taken ages looking at our submission, and they've come back and just said, this is actually quite a nice quote. We're sorry we've taken so much time, but this product is so unique and so different. We're not too sure how to actually assess this from a regulatory standpoint. So back to the FDA, I don't think that will not be an issue because we would have picked that up already if that was the case. But we just have to go through the process.
Thanks, Philip. And just one final clarification on that previous question with Scotland is that a multiple of £50 or Australian dollars?
Oh, sorry. You should use dollars, I guess.
Yep. Okay, we have no further questions, so I'll throw it to you just to provide a concluding comment.
Look, just to sort of say, I would say this. I mean, 12 months ago or a bit more, the question was always from everyone, well, will PainChek be able to convert government beds into paid beds, and how will that work, and will it work, and won't it work? This is the evidence. We're actually 30% market share in Australia, paid beds. It's phenomenal. There's no product that's got such coverage in the aged care as we have, and we're growing significantly. The UK is on a very big track. It was slow in the summer, July, August, because that's the holidays there, and a lot of decision makers are away. But it's all picking up beautifully there. You can see the Canadian results, and we've validated this is a truly global market opportunity, and I hope everyone can see that. And we're continuing to press the button and expand our business.
Thanks, Philip, and thanks to everyone for joining, and we'll see you next time.
Thank you, everyone. Thanks for your time.